You're listening to the Mother to Baby podcast, medications and more during pregnancy and breastfeeding. Ask the experts with your host, genetic counselor and mom of four, Chris Stallman.
This episode contains evidence-based information that's current as of the day recorded and may change as more data becomes available. To get the very latest information about this topic or other topics in pregnancy and breastfeeding, please contact a mother-to-baby specialist at 866-626-6847, by text at 855-999-3525, or through our website at mothertobaby.org. Welcome to another episode of the Mother to Baby podcast. My name is Chris Stallman, and I am a genetic counselor, a mom of four, and a teratogen information specialist. So what I do is I talk to people, patients, providers, family members about exposures that can happen before pregnancy, during pregnancy, while breastfeeding, or in cases of adoption. And an exposure can be anything. So it could be the chemicals at your workplace, it could be alcohol, it could be cigarette smoke, it could be medications, it could also be an illness or a disease. And today we have back with us Becky Spencer, here before to talk about maternal mental health, but today we're going to be talking about HIV and breastfeeding guidelines for people in the United States. First, though, Becky, welcome back to the show.
Thanks for having me back.
Can you remind our audience a little bit about your background?
Sure. So I am a psychiatric mental health nurse practitioner, and I specialize in perinatal mental health. I'm also a professor at Texas Women's University, and I teach in the graduate nursing programs there.
Awesome. And a lactation consultant, right?
Oh my gosh, how could I forget that? I'm also a lactation consultant.
I think you were testing me. That's okay. So can you give us a brief history of the guidelines for people in the United States with HIV who also want to breastfeed?
Sure. Well, before January 2023, the CDC's guideline was a clear no. HIV was one of the very few instances where breastfeeding was completely contraindicated. And that was really the guidance that was given to women with HIV and birthing people with HIV who got pregnant, was absolutely not.
And there have been some recent changes, as you said, January 2023. Can you tell us a little bit about those changes?
I think to preempt that answer a little bit, I want to talk a little bit about why some of these changes have come to play. There have been such great advances in antiretroviral therapy that people who are on antiretroviral therapy can achieve viral loads of virtually undetectable. So many women and birthing parents, if they stay on antiretroviral therapy through pregnancy, are not passing on HIV to their infants. But breastfeeding has always kind of been the question that's out there. So women with HIV and birthing people with HIV have been having babies. They just have been really kind of suggested not to do that. Now, there are women with HIV who have chosen to breastfeed their babies. And unfortunately, I know instances of women who people have called CPS on them because they're afraid, that they're harming their infants. I have heard stories of women with HIV who will pump and pasteurize their own milk to try to destroy any virus that might be in their milk. So some of the change of the guidance for breastfeeding is because we now have research that says people with HIV who stay on antiretroviral therapy have less than 1% chance of transmitting HIV to their infants through breastfeeding. So it's about time that we finally decided to say, hey, people with HIV who want to breastfeed need to be supported. And that's exactly what the CDC has come out and changed their guidance. And that was January 2023. So now we're in a point where we're trying to decide gosh, what does that look like clinically? How do we support women and birthing parents who have HIV and breastfeeding? What does that support look like? And we're working on it. It's not perfect yet, but we're starting to see some publications and some organizations start to put a lot of that great guidance together. So the guidance that I would give to healthcare providers is to really follow the lead of the pediatric infectious disease specialists. Pediatric infectious disease specialists are really kind of leading a lot of the charge in this movement to support people with HIV and breastfeeding. So following their guidance, I think, is important. Really, the most important thing that a person with HIV who wants to breastfeed can have is a really strong interprofessional team working with them. People who need to be on that interprofessional team and all on the same sheet of music are the obstetrician, the pediatrician, the infectious disease pediatrician, lactation consultants. All that team really needs to support and surround that person in supporting them with their decision to breastfeed.
I know that when I heard about this, I was very hopeful for what could be. And part of my hope is that this will remove or reduce some of the stigma around HIV and breastfeeding. So what I'd like to ask you is that where things are going? Is there hopefully going to be some reduction of the stigma of breastfeeding while you have HIV?
We certainly hope so. And I think I'm very thankful for the CDC for their guidance. And now the real work is in making determinations. What are the real guidelines? What are the suggestions that we need to support for patients with HIV who want to breastfeed? So some of the guidance that's starting to come forward is one, definitely staying on the antiretroviral therapy through pregnancy. So really adhering to that medication regimen throughout breastfeeding is incredibly important. The recommendation is still to breastfeed exclusively versus give breast milk and formula. Okay. That has really been the guidance in other countries. Internationally, where the recommendation to breastfeed for people with HIV has been in place for many years. But that guidance was really exclusive breastfeeding was really best. And that guidance is here in the United States. So there is the second recommendation is that if you want to choose breastfeeding, to try to do that exclusively as much as possible. The one guidance that is maybe not to choose to breastfeed if you're a person with HIV is if you are actively using any substances. So marijuana or any other type of drug use, that is a contraindication. Anything that might interfere with your ability to stay adherent to your medication regimen. And then the other recommendation or women and birthing parents that want to breastfeed with HIV are going to need to have more viral checks. So you're going to need a few more blood tests. The recommendation now is to have your HIV levels checked pretty frequently in breastfeeding. Still waiting for a lot of that guidance on what that schedule is going to look like. Sure. But both mother, birthing parent, and baby will need to have their viral loads checked pretty frequently within during that breastfeeding time, and also continuing for a while afterwards.
You know, and I want to say we teach our students a lot about, patient interaction and empathy and listening, and also working on ourselves as providers and so on. And so for providers, please know that we know as professionals, I'm sure again, you've been in the game for a very long time, that bias happens. To say it doesn't happen or that we will eliminate bias completely is wrong. But the idea is to accept the fact that bias happens and find a way to move past it so everybody can win. So the patient and the family members and the provider, are all on the same sheet of music, which I love and I'm stealing, by the way. It's so much nicer than saying all on the same page. But really, recognizing that bias happens and finding a way to move forward to best help your patient.
Yes, definitely. Along those lines, trying to combat the stigma, the best way we can do that is with information, is to get as much information out as possible, both to patients and providers, about what this new guidance is and support that's out there. So I do have a couple of great organizations that are doing some great work here. The Well Project is a fantastic organization that's been around for many years that has been helping support women living with HIV and living their best lives and being who they want to be. And so now they also, with this new guidance, they have a new sub-organization called BIBA, which is building equity, ethics, and education on breastfeeding and HIV. And this is just a wonderful organization. Several mothers who have made the decision to breastfeed with HIV provide great support and guidance to new patients who might say, new parents who might say, gosh, is it really okay? Yeah, it is. And there's great guidance out there for that. They also provide some great education and materials for providers as well, and I think we'll continue to see more and more come out within the Well Project, supporting people with HIV who want to breastfeed. The other organization I wanted to talk about briefly is the AIDS Education Training Center program in the Pacific. They also have had some really excellent webinars that I think are now available as recorded webinars, really talking about what needs to happen from a provider level. Mm-hmm. What medications are we talking about? What are the dosing guidelines? What do we really need to be concerned about from a provider level about supporting these families?
And Becky, just so you and our audience know, we are going to put information from the organizations that you provided today in our show notes. So that way people can go and take a look at those websites. Patients and providers are encouraged to do so.
Excellent. Glad to hear that.
And before I let you go, what is the final thought you would like to leave our audience with?
I think the final thought that I would leave you with is to just be welcoming and accepting, and to understand that people can choose to breastfeed with HIV. They should be able to breastfeed. There's so many benefits of breastfeeding, and I've been so sad for so many years that hasn't been an option for women in the United States. For providers, I would say, really follow the guidance and take advantage of the resources that are out there so that we can support women and birthing parents in doing what they want to do and being the best parents that they want to be.
Awesome. Becky, again, thank you so much for being back on the show. I have your information. I'll be contacting you again. But for this, especially on this incredibly important topic, thank you for coming and giving us this information today.
Oh, you're so welcome. Thank you for inviting me, and this was a lot of fun.
And that's a wrap on this episode of the Mother to Baby podcast. Be sure to hit that subscribe button. That way you never miss a new episode. And you can always go back and listen or re-listen to older episodes as well. You can find us on iTunes, Spotify, Audible, or however you listen to podcasts. If you want to be on the show, or if you have an idea for a show, let us know. Feel free to reach out and email us at contactus@mothertobaby.org. And of course, remember, Mother to Baby is here to answer your questions. You can reach us by phone at 866-626-6847, by text at 855-999-3525. You can visit us on our website at mothertobaby.org. There you can chat with an information specialist. You can look at our hundreds of free fact sheets that are written in English and Spanish. You can find out how you can help out with our pregnancy studies. You can find podcast episodes, baby blogs, information pages, and so much more. So until next time, remember, Mother to Baby is here for you. Take care.
Mother to Baby is a service of the nonprofit organization of Teratology Information Specialists and supported by the Health Resources and Service Administration of the U.S. Department of Health and Human Services. It's made possible through generous donations from listeners like you. To learn more about Mother to Baby, please visit mothertobaby.org.